Our next acronym is going to be our Nsaid. Now, Nsaid is really useful for us when we are actually putting our patients into potential spine motion restriction. For our Nsaid, we try to determine, does my patient need spine motion restriction or do they not need spinal motion restriction? So I'm going to go ahead and I'm going to assess and look for any potential causes that say, hey, make sure that you put your maybe C-collar on your patient and protect their spine throughout this call. The N stands for neurological deficits. Any neurological deficits, maybe weakness on one side of the body, paralysis, or maybe numbness and tingling, right? Those would be things that would be considered neurological deficits. If my patient has one of those, I can suspect spinal injury, so definitely go ahead and protect that patient's spine. S stands for spinal tenderness. Spinal tenderness is as you push on that patient's spine, right, or on their vertebrae, do they have any tenderness when you push on it? And do they also have any maybe step-offs? A step-offs are those little shark fins on the back of your vertebrae. If one of them is broken off, right, we can feel that it's missing there. That's a deformity. We're going to be assessing potentially any broken vertebrae as we feel all the way from the patient's top of the spine all the way to the bottom of their spine. Our A stands for altered mental status. If my patient is altered for any reason, maybe they hit their head, I should be suspecting that they could have also had a spinal injury. So I should be protecting their spine in that call. I stands for intoxication. Right? My patient's drunk, inebriated in any way, maybe that's drugs or alcohol, I should also be protecting their spine because they can't accurately tell me, right, if they're having pain somewhere. They also maybe aren't feeling the pain quite as much based off of whatever, alcohol or drug that they've been taking. And then the last one is going to be distracting injuries. If the patient has a very obvious and distracting injury where maybe it's causing them so much pain that it's distracting them from potentially any pain in their back, again, we should also be thinking about protecting that patient's spine. Again, that's our Nsaid. That helps us determine, maybe for which patients we need to do spinal motion restriction, and that's neurological deficits, spinal tenderness, and step-offs, right? Any altered mental status, intoxication, and distracting injuries.